That's right. It's the top of the hour on this Love Liaison Thursday, people. And of course, you know that I love my community. Yes, I do. And I do my best with, of course, my foundation, the Electrolytes Foundation, in collaboration with the Positive Foundation to bring awareness to the community of St. Martin. And of course, this month is observed as the National Men's Health Month. And in the studios with me today, I have a very, very special person that has agreed to talk about his journey, his story regarding prostate cancer awareness. So I just want to say good morning to Mr. Roger Snow, or actually Roger Snow's son, Gordon Snow. Yes. I guess I was how you say, thrown off by the white hair. Like father, like son. Yeah.
Yeah, they say I have his hair. That's
Yes, yes. So Gordon, welcome, and thank you so much for doing this. I think it's very important that we spend time reflecting in our community with regards to prostate cancer awareness. It is a big taboo here on the island of St. Martin. A few years ago, actually in 2019, the St. Martin Medical Center reached out to the foundations and really, as they would say in Dutch, trekken aan de bel, reached out for us for help, and we whipped up that campaign, Man Up, Check Up, within 14 days, literally very fast, and we've hit the ground running ever since. So welcome, and I'm so happy that you agreed to share your story. You reached out to me, and I was very touched by that. So thank you, and the floor is yours, Gordon.
Yeah. Well, thanks a lot, Mercedes, for having me.
Yes.
Yeah, as I told you, during my experience over the past, it's almost a year now.
Mm-hmm.
I've come to realize that once I knew I had to deal with this disease,
Yes.
I had to reach out to people that themselves have had issues with this,
Mm-hmm.
and there were several people in the community that were ready to talk to me. And I found that really helped me in my decision process on how to deal with this disease.
Yes.
And it helped me ultimately successfully so far. Touch wood on that. But I decided for myself that I could do something back for other people.
Yes.
Because I'm sure that there are a lot of people out there with questions about this disease, and when they first are confronted with it. I also want to say here that they shouldn't feel afraid to call the Herald and ask for me, and if they want to talk, I'm there. I can help. I know other people have done it for me, so the least I could do is help other people out. And I've come to realize how widespread this problem is in St. Martin.
Definitely.
And I can
Definitely.
really impress on the men of St. Martin to go and have themselves checked. And when I say go and have yourself checked, it is go and have a blood check,
Mm-hmm.
because that's how it starts.
A PCA,
PS,
PSA test.
yeah, prostate specific antigen
Antigen test, yes.
test. You can do that as part of your normal blood test. You ask your doctor to write out a blood test form for you. Your insurance will pay for it, if you're insured, of course. I mean, that's not a problem on the island, of course. Some
Of
people aren't
course.
insured,
Definitely.
so that step for them is a lot less easy. It costs money, but I can advise to do that every year.
Mm-hmm.
I started when I was 40. My doctor advised me. I'm a healthy man. I do a lot of
A lot of
sports.
sports, correct.
Do a lot of sports. I walk a lot. I try to eat healthy. But still, this can hit you,
Mm-hmm.
and it hit me. Now at in my mid 50s, and in fact, it surprised a lot of people. Say, yeah, but you always live a very healthy lifestyle. So yeah, but it doesn't have anything to do with that. This can, it's like with breast cancer for women.
Yep.
It can happen to
Doesn't
basically.
discriminate.
It doesn't discriminate, and pretty much most men at some point in their life will get an issue with their prostate.
Well,
Uh,
Gordon, I'm so happy that you are relaxed enough, and I told you when you are ready to talk about it with the community, and of course help the Positive Foundation and Electrolytes Foundation on our quest to continue to have that call for action for men to really break the taboo in the community, to start the conversation, to start talking about it. How was it for you sitting in the doctor's office and he announced to you, Gordon, you have prostate cancer? How was that for you like? What was that feeling? What went through you when the doctor said that to you?
Well, it's the way I found out. Yeah, I did the blood test,
Yes,
so I had a heightened PSA level,
correct?
and then you have to go through a series of tests. Now, of course, the first thing, and that's one of the taboos in our society. I think why a lot of men are afraid of taking that step is because they fear of that finger test,
Mm-hmm.
that famous finger test. That's the least of your problems in all of this. I can assure all the men out there that's really that is a 2-3 second thing, and that comes later on in the process once you they actually are pretty sure that you probably have cancer.
Right.
And when I heard that I had it, yeah, that hit me in the gut. It took me 2 or 3 weeks to get
Head around it.
my head around it, because yeah, I felt stressed. You feel your whole life going there before you, and you start thinking, oh, how long do I have left?
Of course.
Because I wasn't too familiar with the disease yet at that point, and how much time do I have left? So then you suddenly start thinking about a bucket list and those sort of things. Yeah,
Yes.
it was a very stressful period, but that's when I decided to snap out of it. I talked to a couple of people, and one of my friends who actually also works at the medical center told me, listen, I mean, start reading up on it, and it's a disease that is a very slow-moving disease if you have the most common form of prostate cancer. I didn't have an aggressive form. I had the most common form of it, and at an early stage.
And that is a
So
key thing, an
yeah,
early stage. You got it at an early stage.
yeah. But that's also because of regular checking. Huh? If you
Correct.
do regular screening, I try to do a blood test every year.
Mm-hmm.
That's how I found out, and then you catch it early, and then you have your options are more widespread. You have more
Of
options
course.
of what to do about it. And yeah, I decided to talk to people. One important aspect in all of this is that stress is not good for you. Stress is something that destroys more than it builds up in your body.
Yeah.
It is incredible how worrying in your head can affect you physically. So it's
It's like
very,
psychosomatic, and it affects you, and people
yeah,
really don't realize sometimes. They say stress can kill you because it can
absolutely,
actually
yeah,
kill you. It
yeah.
affects your functioning, your day-to-day operations, the things. It gives you pain in your stomach. It can do a lot of things to you.
So I did two things. I
Mm-hmm.
started to talk to people. I started to research the disease, and I also started to do things like meditation. I always used to laugh a bit about people that did yoga and
Yes.
things like that. I always had that sort of iffy. I was a bit iffy about it, but then I really started to notice how beneficial it is, both in the morning and the evening,
Yes.
to just do breathing exercises for yeah, about 10 minutes. That
Mm-hmm.
really helped me. It really helped with sleeping. It really helped with easing me down. But I also started talking to people and see what my options were. And yeah, I talked to, for example, Mike Ferrier, who, as you know, is also very open and who's also helped you out. And the experience that he had, and I learned that we actually live in a very lucky age, because now this is one of the most treatable cancers out there.
For
That's
sure.
also
With all the
something that's
new
very important for
technologies.
men to know because
Mm-hmm.
of all the technologies. So if you screen yourself regularly and you find out that you have to deal with this, go and deal with it immediately. Don't let a doctor tell you, well, it's manageable for now, and we'll see what it looks like in a couple of years. Don't just deal with it straight away.
So,
And
so on your journey to deal with it straight away, what was your next step? So you found out, you went through that mental process of, your life flashing in front of you, thinking
yeah.
about a bucket list, and then what was your next step? Did you have to, go to further tests? Would you have to go away? What did you have to do?
Well, yeah, I had to go through a whole battery of tests. In fact, I did almost every test in the book at the hospital because I wanted to check up the rest of my body also. I did what they call a colonoscopy, so they
Yes,
check
makes
out
sense.
your colon.
Mm-hmm.
Because once you're over 50, it's very important that you do that every 5 or 10 years. That's generally recommended by doctors. So I did that. I tested my heart, although I knew that was all okay because I do a lot of sports. So yeah, you want to make sure that everything is okay to get a general test.
For sure.
But yeah, I had a number of options that you can take once you know that you have the cancer. Then the question becomes, is it confined to the prostate or has it spread?
Correct.
Now, it's very difficult for them for doctors to ascertain whether it is actually spread. Yeah, it's a very technical test that they got to do. But in my case, they didn't think that
Was
had
the case.
happened yet because
Okay.
they thought it was confined to the prostate and because of the level of my PSA. I had a PSA of 12.3. Now, for the listeners, anything under usually the doctors start to worry if your PSA goes above the 4.
Correct.
Um, and once it goes above that, yeah, then you really gotta go and do some checkups. Mine was 12.3,
That
and
was very high, actually.
that was very high compared to the last time because I had checked 1.5 years before that, and of course we had the pandemic, so I
Yes.
didn't go to a doctor's office for a while. So I was confronted with a PSA of 12.3, and yeah, I knew that in all probability I probably had cancer. But mind you, PSA of that level can also indicate that you have a growth in your prostate that is benign. So then it's not cancer, but your prostate is growing. Now,
Enlarged prostate.
yeah, an
Mm-hmm.
enlarged prostate. So the men can have that also, and they often find out when they don't screen on a regular basis, when they suddenly have a lot of pain in the area and they have problems peeing in the morning or just peeing in general.
In general,
They have a
correct.
very thin
Stream.
urine stream. So yeah, then if you get to that stage, it might be a cancer, and if it's cancer, you have a problem because then you're probably at a more advanced stage already. So and then it becomes more difficult also to do an operation. And now I didn't. I choose to do an operation. I'll get to that in a moment as to why I choose that, because you have a number of options. Huh? When you're at my stage, the early stage, you can do an operation, you can do radiotherapy, you can do, yeah, there's a
There are
number
many
of technical
options,
terms. There's a
yes.
lot of options. But I actually, when I heard that, I thought, okay, I have cancer. Well, let's do the radiotherapy first, and then maybe, if it ever comes back, I can do the operation. But my uncle is a retired surgeon. I'm
Yes.
named after him, and he told me, "No, Gordon, that's a very bad idea because if you do radiotherapy, the radiotherapy actually burns little patches in your body. That
Correct.
if you do an operation afterwards, you get complicated bleeding. So for a surgeon, they will probably not want to operate you anymore in that area because it just becomes very complicated because for them to stop the bleeding." But in my case, because I'm very fit, I don't I don't have diabetes. I don't smoke. All the things that you hear about COVID also, if
High risk
for high risk people, it comes back here also. So it also,
or
um,
underlying conditions that you may have and stuff like that.
yeah, yeah, that comes back here also. And again, I'd like to stress a healthy lifestyle is important for people. Yeah, they tell you you're an ideal candidate to get operated. Now, we of course here have two very very competent
Urologists.
urologists, and we're lucky to have them because up to a couple of years ago we didn't have those on the island.
And I think that plays a very important role. Dr. Ramos and Dr. Rojas
Correct.
also
Yeah.
have been a very crucial development in the prostate cancer awareness campaign that we've started a couple of years ago.
Hmm.
And I think because of their alarming findings in the community of St. Martin, the need was there to, shake
Yeah.
up the
Yeah.
community and say, hey, listen, there's a lot of men out there walking around with prostate cancer and they don't even know it because perhaps they are not aware of it, and
Well.
they sham it off. Oh, a little pain here in the back, or I can't pee so good, or
Yeah. Yeah.
it's like
Yeah.
man issues that they do not want to really discuss
Correct.
openly
Yeah. Yeah.
or amongst their peers.
Yeah, well, that's the thing. In my case, I again, as I said, I'm doing my sport fit, so I didn't feel anything. I
Right.
just went for a regular checkup. I didn't.
Mm-hmm.
I wasn't expecting to, maybe a heightened cholesterol because you've been eating bad or something. That sort of thing you would expect, or maybe a little sugar. But none of those. I heard it was I had a high PSA level, and I didn't feel anything. Like a lot of men already have a enlarged prostate at that stage, or feel some sort of pain. I didn't feel any of that.
And
So that's
that's a
the
critical component that you just mentioned. You
yeah,
didn't feel anything
correct. Yeah,
whilst your PSA was so high,
yeah,
you
yeah.
know?
Yeah, and that is with cancer in general, Mercedes. That's
Mm-hmm.
that's the treacherous part about this disease. It can sometimes sit in your body for years, and you just don't even know it.
Yeah.
And in this case, you have a way of finding out by screening yourself. It's probably not possible for all cancers, but for prostate cancer and for breast cancer for women, and for cervical cancer for women, I think also you can
Yes.
get screened. So you can find out at an early stage by regular screening whether you have it or not. So, and that's again, I keep emphasizing it. This is important for people and for men to go and do out there. And I know that several of my friends, because they were shocked to hear this, and they actually went to do checkups themselves.
Very good.
Fortunately, I was very glad to hear that they didn't have any complications.
Of course.
But I was glad that they took the example to go and check themselves. That's the important thing, and I hope more men do it because, yeah, Dr. Ramos told me, he sees it every day in his clinic. There
Mm-hmm.
is an absolute epidemic out there. It's a lot of men have it, and
And you coming here to share your story, the beginning of your journey. As I said, Shelly and I, we discussed your case, and I told her, hey, Gordon Snow, he's really, really wants to help us on our quest to help save lives in the community. And I think, men like yourself, men like Mr. Michael Ferrier, to come out and speak openly, gives that sense of, hey, I have cancer, but I am treating it. I got screened, I got the tests that were required, I've done the treatment, I'm still on my journey.
mhm.
And sharing your story openly, of course, I guess it's kind of therapeutic for you as well, but it also helps other men in the community to break that taboo of silence and start a conversation in our community. Like you said, you started to talk with your friends and reached out to various people in the community, and you did not wait.
Yeah, well, that's essential also because I know of a case where the person waited too long, and afterwards it became an issue,
Yes.
and now has a more complicated problem to deal with. And I that when to get back to my decision making process also. I first started did radiotherapy. I talked to my uncle, but one crucial person who actually made me realize why don't you do the operation was a lady who works in. She's the wife of a friend of mine. She works in the medical community, and
Yes.
she said, Gordon, I was, I was having a conversation with her at Lagunis, I think it was, and she told me, why don't you just have the operation, the what they call the radical prostatectomy, and
Mm-hmm.
because you really don't, the prostate is probably one of the organs your body can do without. You can
Correct.
survive perfectly without a
A
prostate.
prostate.
Having said that, of course, that actually got me on this journey. I said, well, she's right. And then I also talked to my uncle, and and since they said you're a perfect candidate to do the operation, I decided to do the operation. But before you do that, you got to realize when you do the operation and you remove the prostate, you cannot have children anymore afterwards. You
Of
cannot.
course, there are different consequences by doing that
You can
radical
you can have a
removal.
normal sex life. You can have a normal sex life, but you cannot have children anymore.
But and that's the critical question right there, because a lot of men, they think, prostate. We know that it helps to procreate for the future and
Yeah,
bring
yeah,
kids to life and all that good stuff. But at the same time, men are worried that they will have that erectile dysfunctional syndrome, that their penis would not work anymore.
yeah,
And we all know that the male counterpart is something very private. It makes them
yeah,
feel
yeah,
very macho and
yeah,
all
yeah,
that stuff. So it's the reason why in our cultural community a lot of men do not want to talk about that, whilst men have a lot of
yeah, yeah,
male issues.
yeah, yeah. Yeah, well, I have to point out that when I say you cannot have children anymore, in my case, a surgeon, it's a female surgeon in Panama,
You did your
Doctor,
surgery in Panama? Yeah.
yeah,
Okay.
at the Panama clinic. This was in the time when SZV still sent. This. I'm talking about 3 months ago, on the 2nd of February. That's when I got operated,
Okay. That's just
and
recently.
that's just recently.
Recently.
Yeah, yeah. And a lot of patients from St. Martin got sent to the Panama Clinic at that time,
Mm-hmm.
because SZV had a working relationship with them. I think they ended it now, and they're now working with a couple of other hospitals in Colombia and Dominican Republic, or is it Puerto Rico? I'm not sure. But a very good clinic, and the lady surgeon there was recommended to me by Dr. Ramos. She's a very competent surgeon, and she operated on me with what they call a Da Vinci robot.
A Da Vinci robot.
Yeah,
It sounds like
I call that
really high tech.
what is that Arnold Schwarzenegger movie again? It's the
Terminator.
Terminator. I called it the Terminator robot. It looks like one of those things when you see it in the operating room.
Oh wow.
But yeah, what they do is they create 6 incision points right across in a horizontal line above your belly button
Okay.
on your stomach, and that's where they go in. So they push your intestines aside, and they because the arms have to go down and reach down to
The prostate.
the prostate. They gotta have the room, and that's where they go to work. And they take out your prostate, and they take two glands that are directly above the prostate. And both the prostate and those two glands help to produce a liquid to help your sperm swim.
Correct.
Which is why when you remove that, it becomes more difficult to
Kids.
have kids.
Mm-hmm.
But what the surgeon did tell me is, he said, listen, if you still want to have the option to have kids, we can remove during the operation. We can remove some semen and put it on ice for you.
Mm-hmm.
So you have that option. So for men out there, if they want to, if they are considering this because they're in the same situation, you can ask your surgeon that, and they can do that for you.
Well,
So
these are
that,
critical things that you're sharing right here, because a lot of men per se don't necessarily know about the options once you have reached that stage
yeah,
of knowing you have prostate cancer and you have to do a radical removal of your prostate. That the
yeah,
options is like, I want to still have kids. Is it possible for me to just freeze some of my sperm for
yeah, yeah,
later down? So
yeah, yeah.
with the new technologies that we have nowadays, a lot of things
It's
are
so easy
possible.
to extract, and you're going to
Yes.
be under anesthesia. You won't feel anything. They extract it. That's very easy for them to do.
Right.
So you have that option. So that in itself, the having of children, I decided myself. At my age, uh, I don't have children. So for me, right now, I don't have a wife or a girlfriend at this moment, so for me, it was also an easy decision to take. I
Correct.
didn't have to take somebody else into consideration here,
Mm-hmm.
and but for other men, it's important for them to know you have that option. So
And
you
I
can
think
ask your surgeon that, and you know,
I think that's a good option to have. That, you know, despite you discovering that you had that prostate cancer, being getting the needed information to
yeah,
help you to make an informed decision. Thank God you had a uncle that happens to be a surgeon that
yeah,
told
yeah,
you, and you spoke to this lady. So all the dots were connecting, and you did your own research. And of course, I guess in Panama too, they explained you all the different procedures and different options that were there. So you were, how you say, in a trajectory where you can always had control of the decisions you were making for your health.
yeah, yeah. But I must say, and Dr. Ramos told me that also because I thought, okay, and, you know, he gave me the options. Think about it, but take time. You know, this is in its most common form a very slow-moving kind of cancer. So I had time. But yeah, when you hear that you have cancer in your body, you
Of
think,
course.
yeah, well, the docs can say whatever they want, but
Correct.
and then suddenly in 2 months' time, I suddenly find out that. But you know, yeah, it's. I just wanted to move as quickly as possible, and the yeah, fortunately the option was available in Panama because remember in at the end of last year, the beginning of the year, you had the pandemic situation in Europe in
Yes.
Holland. Everything was closed down, and I you know I had a Zoom meeting with a surgeon in Panama, and she was available for me straight away. She talked to me for an hour, and I immediately
A
felt
good
very
connection.
comfortable, a good
Mm-hmm.
connection with this person. I didn't feel that with the clinics that I talked to in Holland because, you know, you ended up in an answering machine system, and
Yes.
they put you on a waiting list, and you know. I don't want to badmouth Holland, but yeah, because I was in the early stage cancer, I guess they figured, well, you know, he
It's
has
not such
time,
an
so
urgent matter
yeah,
for
and
him. Mm-hmm.
but in this case, I could get that operation quick, and I said, you know, I'm not gonna wait.
So let me ask you, Gordon, with regards to the time you found out your diagnosis
Yeah.
to doing the operation, what time span are we talking about? Because you said you just recently did your operation
hmm
in February, but when were you then diagnosed? So how, what
I
was the
well,
time span?
I had my PSA test in August of last year.
Okay.
Then yeah, you go through your battery of tests. So and I had to do the biopsy also. The
Yes.
biopsy results, if I remember correctly, I got to know somewhere in early November, and that's when I started to talk to see, okay, where am I going to do this operation. I
Okay.
talked to Dr. Ramos about it, and then I could actually already have done the operation in mid December. But yeah, then the doctors told me, listen, you have time. Both the surgeon, Dr. Ramos, told me you have time. It's not going to change anything. You have time because you're at a very early stage. So go and celebrate Christmas,
Christmas
and then
and
we do it
enjoy
straight
yourself.
after Christmas because
Okay,
otherwise you're
makes
going to get
sense.
stuck in Panama. And we still, yeah, we didn't know if Panama was going to be hit by a pandemic wave, and then yeah, then you're going to get stuck in a hotel there and whatnot.
Yeah.
And then I also ended up with COVID myself.
Ooh.
I
Ooh.
actually found out because I had to do the test to fly, so I didn't even know I had it. So I had it somewhere.
Asymptomatic. Okay.
Yeah, well, I had a little bit of a little cold in
Sniffles here and there.
late December, but I had my booster shot already by then and everything. So I figured that because of that, and because I'm pretty much healthy, that I was lucky enough, to have had it so mild compared to some other people. Um, but yeah, so then I had to. I could have had it mid January, but I ended up having it in early February. So that was my timeline.
All right, so that's an interesting timeline. Like you said, it could have gone
Yeah, yeah,
faster, but you decided from say August until February,
yeah.
you got your operation. Now let's talk post op.
Yeah.
because I think that's very important to mention. So you did the surgery,
Yeah.
you finished, you're there in Panama. Now you on your way to, between brackets, recovery stage.
Yeah.
How was
Yeah.
that for you? And did you have the support from your family? Because a lot of times we say, that person has the disease, the cancer, but we forget to talk about the family that you have. How does that impact them, and how did they help you, or your friends helped you on your recovery process post
Well,
op?
um, for the recovery, I didn't have family at the time when I got operated. My sister came for the second week because I was there for 2 weeks in Panama. And but I got a lot of messages from people, and I got a lot of messages from friends from St. Martin. Everybody was worried sick because the first day when I was operated,
I can imagine.
I didn't communicate to anybody. So everybody was wondering what the hell was going on. So then the next day I started sending messages again. But yeah, the of course, like with any operation, the first thing you got to worry about is embolisms. That they start to move you quick. That you the first day you rest, but then the second day, because this is a long operation. It's a 4.5 hour operation.
Tedious,
Kid you
yes.
not. It's but because it's not as invasive as the normal operations where they have to cut you open, because these are small incision points.
Incisions.
You recover quicker, so you can leave hospital after like 2.5 days. But I had some familiar issues that people have when they're just operated. You can't stool for like 4 days or something,
Mm-hmm.
and you're eating 3 times a day. And you say, where the hell is everything going? And they actually realize how big your intestines are.
Yes.
So, but that's because your intestines are moved during an operation like that. They
Yeah,
push it
a
up.
kind of trauma. Your body is going through a kind of trauma.
Yeah, that's a
Mm-hmm.
recover. But as long as you give wind, the doctors say you're good. So it's just a question of time. And but another interesting part was that you have a lot of pain in your shoulders because they pump a lot of gas in your stomach so that they make room for the arms of the robot to operate. The gas goes up against your diaphragm, and so you have a lot of pain in your shoulder. This is a very very weird feeling to.
I can
I
imagine.
thought like, what the hell did they do with me, And so it's but then I had already set myself, because I was already fit going into the operation. I set myself, I want to start walking as much as possible. But the problem is you have a catheter in your crown jewel, so to speak. And
And of course, that's
that's
not a pleasant feeling. I've
it's not a
heard a
pleasant
lot of
feeling.
people
Yeah,
talk about it. It's not a pleasant feeling to have
yeah,
a
yeah,
catheter in your crown jewels, as you so
yeah. No,
nicely put it.
it's yeah, it's not a nice feeling. It's because if you walk, yeah, you
You have to
get.
walk with it.
Yeah, you have what they call a pee bag also
Mm-hmm.
attached to your leg, so you can actually see the urine pass through
The catheter.
the catheter. Yeah, that's not. And you in the beginning, I worried about, yeah, should you walk in public with this, and then people are looking at you. But then afterwards you say, well, I the girlfriend of my cousin later told me, man, you own that thing. I was walking around like the man. At a certain point, you say, okay, well, this is it. I'm here in a hospital, and in the surrounding area around the Panama clinic, there's a lot of patients running around. So yeah,
Of course.
people are used to that. So I had to wear that thing for a week. That was the plan, and they took it out after a week. And then initially that first day, everything was going okay, because what they look at then is, can you urinate okay?
Yes.
Because one of the complications you might have after an operation is what they call leakage,
Mm-hmm.
and that's that you don't have complete control over your bladder.
Correct.
And of course, yeah, and then a man has to wear what they call man diapers, and that is a very, yeah, that's a very, how do you call that? It's very humiliating experience to go through. Now, I only wore that for one day because just in case, but I didn't have that problem, and because the operation went well, and It also depends on how you go into an operation. As I explained to you, I didn't have pain. I didn't have
Correct, and
a
you're very
swollen bladder.
mm-mm.
Because if you already, or a swollen prostate, if you already have a swollen prostate, that can affect your bladder also.
With your urine flow.
Yeah.
Yes.
So so that can be an issue already. So then for men that already have that, the risk is higher that after an operation like this, they might have leakage for a while. And I fortunately didn't have that, but what I did encounter late at night when I was in bed, I suddenly had urge to go to the toilet. So I thought, okay, let's go and urinate. And I couldn't. And that's what I call urinal retention. So then
Mm-hmm.
I suddenly started to get worried. What the hell's going on? So fortunately, early in the morning, I alerted the surgeon, and she wasn't, she didn't have a long surgery. She only had a small operation of like 45 minutes. So she was immediately available for me, and I had to go there. And she said, "Well, Gordon, there's two options. I'm gonna try and put the catheter back in without anesthesia." So I had to do it. I didn't even
What?
feel when it happened.
Eenmalig katiliseren, they call that.
Yeah,
Yeah.
that
Mm-hmm.
so and if that doesn't work, we have to get you back into the operating room, and we have to do a mini operation. But what happened in the case, of course, what can happen is because you have been operated. I have to explain to people when they remove the prostate, you have what your urethra, your urine channel that leads from the bladder to basically to the outside.
Correct.
They have to that the prostate sits around that urine channel. So when they cut the prostate away, they have to cut a small part of the urethra,
Correct.
and then the rest of the urethra has to be reattached to your bladder. So on that point where they reattach it, at that point the flesh will be inflamed a bit, and that has to settle. And that apparently hadn't completely settled yet. So I had to deal with this problem called urinal retention, and that's very dangerous because if you leave that too long, the urine can flow back into your kidneys, and then you're in a world of hurt. That can be life
Of
threatening.
course. And and,
So
and, and
that's
and that's important for people to know that, it's a surgery. There are post-op complications that can happen. In your case, you were able to, you know, get solutions and
yeah yeah
get it treated right away and start your recovery process.
yeah
So
yeah.
once you were in the room in Panama, what type of thoughts went through your mind? Like, oh my goodness, I did this surgery with what you call the Terminator high tech operation equipment,
Mm.
and now you're in your room thinking about what next. What was next for you?
Well, I in the beginning I tried to put a regular, how do you call that, a regular routine,
Regan?
and
Mm-hmm.
started to walk every hour or something. You have to walk for 10 minutes in the beginning, and then you gradually increase that. And but of course the most important part was after an
That
operation like
a
this
lot more
is
men
what
in
about
this
the cancer?
community that deal
And
with this issue than you may
yeah,
think.
they what they do once they remove your two glands and the prostate is they send it to the lab and it gets analyzed. And you hear that after a week, you hear the results. Some labs are quicker, depends on what hospital you go to. I heard it after a week, and I sat there in the room. My sister, by at that point, my sister was there too with me, and that was a very nervous moment for me because then you hear, what are the chances that the cancer actually spread? So I had cancer in my prostate. 20% of my prostate had been eaten away already by this aggressive cancer. And then what they look at the border of your prostate, whether there are cancer cells there. They look at whether in the surgical margin, because a surgeon never cuts exactly around an organ, and it cuts in with a margin around it. Were the cancer cells in the margin, were the cancer cells in the glands? And in all three areas, the doctor started ticking it off. Huh? And here sits
Wonderful.
this
Of
Latin
course,
doctor
like
and
a
said,
checklist.
"So eso es bueno, eso es bueno." So and I felt like, oh man, she's buttering me up for the bad news, you know. I was sitting there and I said, okay, bring it on. But then with every point, I started to realize, damn, I'm in a good place
Wow.
because I didn't have cancer cells in any of those places.
Wonderful news.
And then at the end, she said, "Yeah, we have this calculation method of probability based on your on what we have seen here, on what your chances are of survival over the next 15 years, and 99%. They never give you 100%,
Mm-hmm.
because there might always be that 1% cancer cell that is gone on a lime someplace, and no, yeah. So yeah, that became a very emotional moment. Yeah, they say men don't cry, real men. So I can attest that we do. That was an
Because
emotional
you went
moment.
through
Yeah,
a very, how you say, a very intimate a trajectory, finding out you had cancer, finding out it was prostate, relating to your crown
yeah,
jewels,
yeah,
all of that. And like you said, your life flashes in front of you. You went through a whole mental process of
yeah,
dealing
yeah,
with this.
yeah.
And of course, now the physical aspect of getting well. So, at now present, Gordon, can you still, play football? Are you walking? Are you running? Are you,
Yeah,
back to
what
old
they tell
Gordon?
you is the first 6 weeks you're not allowed to do any physical
Strenuous.
sports
Mm-hmm.
strenuous. You can't go to the gym, can't lift anything above 5 pounds. So even for your shopping, you need help from friends or family, colleagues.
Right.
And so I did all of that, but I actually pushed it a bit to 8 weeks. And Dr. Ramos told me, "Hey, my friend, you're good to go, man. Go and do your thing." So that's when I started to. And in the beginning, I tried to take it easy because remember I had that operation
Of course,
across
your body still had a trauma.
the
Yes.
abdomen. So
Mm-hmm.
the risk is that you might end up with abdominal injury. So a muscle tear, and that's not pleasant either. So I try to build it up gradually. But I'm pretty much back. I've been playing soccer again for the last
Wonderful
1.5 months.
news.
I'm now also at Rion Peterson's gym. The parliamentarian. You open the gym, a couple of minutes walk from me in the same street. So I decided to go to the gym also and combine it. And no, it's going well. I'm not 100% yet because there are still a couple of issues because aside from the urinal side, there's the other side also that you might experience some problems with. I'm almost 100%, but that's a question of recovery, and you gotta allow your body
To heal.
to heal, and
Definitely.
that's I think the mental part. Probably after an operation like that is the most it's the most important part. You got to think positive. You got to set yourself targets of what you want to achieve in terms of little exercises that you can help your body to heal. But also again the embolisms. You gotta because that freaked me out when they told me that after an operation
Yes.
that you can still run a risk of getting something like that. I had to inject myself for something like 15 days after the operation
Yes. Blood thinners.
with blood thinners. And yeah, you feel like I've never been afraid of injections. So for me, it's not a problem. But it felt like geez, man, I'm a drug addict or something. Sitting doing that. But
Of
it's
course.
yeah, it's something that you gotta take it serious, but you gotta be positive. And again, try and take that mindset. And,
Well, Gordon, I want to really thank you for opening up to the community of St. Martin. It is Men's Health Awareness Month, the month of June. And of course, the Positive and Electrolytes Foundation take it upon themselves to continue our awareness campaign to man up and check up for the community of St. Martin. You sharing your story here with us here at Oasis 96.3. And of course, we have television cameras in the studio, so it will be viewed on television as
Making a
well.
movie star out of me, huh?
I told you when you're ready, you want to share the story, and I was so happy that you reached out to me, and we are definitely happy for your contribution of giving back to the community, because I think when you start having these types of conversations, you open a sense like a portal where men can feel more comfortable, and we can start tearing down taboos and really discuss men's issues. Women, we get together and we start talking. It's a therapeutic thing. You put three women together, they start talking. You put a couple men together in a bar, they start talking about, oh, did you see the sports? Did you see this? Did you see that? But then you can say, hey, have you checked your prostate? And these are the types of call of actions that we want to instill in the men in our community, that they can start making these type of jokes. Hey, check yourself, get, man up and check up yourself. As we close off this interview, Gordon, any last words that you would like to recommend to our listeners, to the men out there, that about their men's issues or men's health? Anything that you say, hey, this really helped me, and me conveying this message would make a difference?
Yeah, well, I really want to impress on the fellas too, because yeah, it is thought that being macho, keeping those things to yourself, that's a macho thing to do, not to show emotion. But I don't think you should be afraid to talk about this. You should go out, because ignorance can do more damage than anything else. Don't be afraid to ask. Yeah, I work in a profession where we do that every day.
Yes.
If we don't know something, you ask. Don't go and assume something. And especially when it comes to your own health, if you feel anything that is out of the ordinary, ask. Ask your doctor. Ask other people that might have, hey, have you ever felt this or that? Ask. Don't be afraid. I found out that through my asking, I found out that there are a lot more men in this community that deal with this issue than you may think. So don't underestimate this. And again, I like to stress, this is one of the most treatable, if not the most treatable cancer out there. What any doctor, any urologist will tell you, you're more likely to die with prostate cancer than of prostate cancer. It's a small percentage of men that actually die from it, because yeah, they caught it too late. And it's very well treatable. Go and have yourself checked, and that's my message to all the fellas out there. And
Well,
don't try to be macho.
yes, all right. Well, thank you so much, Gordon, for taking the time of your busy schedule, waking up early for me, and coming out and sharing your story here. And I wish you lots of success. And I hope that the Positive and Electrolytes Foundation, we can call on you when we need more assistance to help us spread the word of prostate cancer awareness to help save men in our community.
Sure, as I told you, Mercedes, I've been helped by other people, and I think it's very much the least that I also can do, and I've come to realize how important this is, and the campaign for breast cancer screening for women has been going on for years,
Yes.
all over the world, and now it's become more of an issue for men, and
Mm-hmm.
I think. It's time that we take this to the next level. So, and I'm ready to help you guys out. So call
Thank
me
you so
anytime.
much.
So,
Thank you. Well, there you have it, people. It's Men Health Month, and we just want to urge you to go out there. If you love yourself as a man, or your wife, or girlfriend, grandfather, uncle, whatever, you have men in your life that you love, please urge them to, start the conversation with your doctor. Make sure to get checked. Get your PSA. It all starts with a little blood test, a PSA test. Talk to your doctor about it. Start the conversation. Man up, check up. Thank you so much, Gordon. Thank you.
take care, Mercedes.
Yeah.